my name is Stacey. I am the PhD student Amy was talking about. I want to talk to you a little bit about our project on DEMPORT, the Dementia Population Risk Tool. So as our population ages, an increasing number of Canadians are going to end up getting dementia. And this really is going to be challenging for our healthcare system, our economy, and our families. Late onset dementia doesn't have a cure, and there's really no effective disease modifying treatments, and so prevention is really something that we want to focus on in the coming years. Now, many of the largest factors associated with getting dementia, we can't really do much about. So things like your age, your family history, your genetics. But the modifiable risk factors are largely lifestyle. So think about whether or not you smoke, you drink alcohol, how much physical activity you do, how many fruits and vegetables you eat in a day. Other risk factors are things like if you've had previous stroke, if you have high blood pressure, and even things like your oral health has been associated with being related to dementia. So we are really wanting to think about, look at these different factors and say, what factors can we use to predict whether or not people are going to end up getting dementia? And what can we do to reduce some of these risk factors so that you may reduce your risk of getting dementia in the future? So we're using the Canadian Community Health Survey, population-based throughout Canada, to look at developing these kind of algorithms. We're looking at people 55 years and older and have created some preliminary algorithms so far that have found some interesting results. So our initial algorithms have suggested that former drinkers, those with low BMI, those who eat fewer fruits and vegetables, people with diabetes, high blood pressure, stroke, and those who in general say that their general health is poor, are at greater risk of getting dementia in the future, and we can use these factors to predict whether or not these individuals are going to get dementia. Within males specifically, we found that high levels of stress, needing help with personal hygiene, as well as needing help with running errands are predictive factors in men, and women that have epilepsy or mood disorders, these are also factors that we have been able to use to determine whether or not someone's going to end up getting dementia in the future. So we've put these factors, they're all in our algorithms. We have our preliminary algorithms. We're evaluating and refining these algorithms. And ultimately, just like Amy showed in the last presentation, we're going to be putting these onto our Project Big Life website, which you can then go onto the website, plug in your different factors, figure out, what is my risk of getting dementia, and what can I do to help reduce my risk in the future. That's about it. Thank you so much.